So again, we welcome everybody to the Balance and Falls Prevention webinar. My name is Michael Fernandes. I'm a doctor of physical therapy. Joining me is my colleague, Dr. Bonacquisti. We both work for Kinetic Physical Therapy, and today's topic is balance and falls prevention. So our objective today is to talk about the incidence and importance of falls, who is at risk, what causes falls, and how we can reduce falls. And then hopefully we can leave you guys with some good guidelines on some things to consider that you might be able to start implementing right away. So some brief facts about falling. Falling is obviously an event where you inadvertently end up on the floor or a lower surface. Falls are leading cause of fatal and non-fatal injury among 65-plus-year-olds. And if you look at the statistics, 2.8 million injuries are treated in emergency departments annually, which includes 800,000 hospitalizations and more than 27,000 deaths. And when we look at the total population, 1 in 4 older adults will fall every year. So this is a substantial number, and this is a substantial epidemic that I think we as a society appreciate the effects of falls and what the consequences of our falls, but I don't think we truly appreciate how common it is and do a good enough job of maybe doing everything we can to help reduce our risk of the falls in the first place. So if we look at just in dollars and cents, in 2014, the total cost of fall injuries was $31 billion. That was expected to increase as high as $67 billion by the end of 2020. Certainly, we're not through the year yet, so we'll have those numbers, in the near future. And if we look at some of the common things we hear in the clinic, a lot of people mostly stay at home because that's where they feel more safe. Now, that's understandable given that's the environment that you're comfortable with, but it's also important to appreciate that 75% of your falls take place inside or in close proximity to home. Obviously, there's a connection here with that's where you spend most of your time, but it's important to highlight that just because that you are comfortable in that environment and that's where you spend most of your time, that doesn't mean that you're at a lower risk of falling overall. And if you do have a fall, you are 3 to 10 times more likely to end up in a nursing home for end-of-life care after experiencing a fall. And for those who have suffered a fractured hip, unfortunately, 20% will die within 6 months. So again, highlights the importance of how do we reduce the falls and reduce the risk of them happening in the first place in order to reduce incidences like these. When we look at who is at risk for a fall, everyone. Older adults, young children are our high-risk groups. However, there are many other many other factors besides age. And some of these may be modifiable, some of them may not be, and we're going to discuss those throughout the session. When we look at specific risk factors, we can look at behavioral risk factors, environmental, and biological. Looking first at behavioral risk factors. These include actions, emotions, and your daily choices. Medications. We are mostly aware that certain medications have side effects. Maybe it's vertigo, maybe it's dizziness, maybe it's drowsiness, and these can certainly increase your risk of falls risk. However, one thing that's often missed is that regardless of what your medications are, people who are taking 4 or more medications prescribed by a physician are 9 times more likely to suffer a fall. There's also the difference in risky behavior versus non-risky behavior that certainly are life choices that can certainly increase your risk of falling. If you use an assistive device, are you using it properly and are you using it as often as you should be? Footwear, clothing. Is your footwear appropriate, first of all? Is your clothing loose or is it getting caught on items as you walk? That can increase your risk as well. Gait speed. Gait speed is highly correlated with overall health and well-being. And there is a lot of research that shows that people who have a faster gait speed are at a much lower risk of falling than those who have a faster gait speed. I'm sorry. Those who have a higher gait speed are at much lower risk of falling than slower walkers. Fear of falling. Why is this a behavioral risk factor? That's because people who are fearful of falling will typically reduce their activities and actually become less active. One of the keys that we'll talk about in a little bit here is the importance of exercise and strength as a component of balance. If you're fearful of falling, so you spend less time on your feet walking around, you are going to become more deconditioned. As you become more deconditioned, you are going to get weaker. Your muscles are going to get weaker, and some of your other systems that are important for balance are going to be weaker as well. So then when you go to do your activities and your walks and navigate your environment, your community, you are actually now increasing your risk of falling. So this is why fear of falling is listed as a behavioral risk factor. How can we reduce the behavioral risk factors? First of all, you can review your medications with your primary care provider if you believe that there are some medications that maybe can be reviewed and determined if they're necessary to take or not. Certainly making decisions which are favorable to your safety, wearing proper clothing and footwear. In one study, it was people were more than twice as likely for serious injury from fall if they were not wearing shoes in the home. My recommendation or my thought behind this is no one wants to wear shoes all the time at home, but maybe in the evening times or the morning times where maybe we're a little bit sleepy and distracted, this may be an appropriate time for you to wear shoes around the house to reduce your risk of falling. Preparing yourself to walk faster and with more confidence. Some of what we're going to do today is to try to hopefully help you with that, but coordinate that with a healthcare provider if you're unsure where to start as far as improving that. When we look at environmental risk factors, poor building design or the layout of the building can have an effect if there's not clear hallways or a quality flow to the layout plan. Slippery floors or rugs. Do you have hardwood floors that are often waxed or oiled? Uneven sidewalks. Do your sidewalks have a little bit of a lip to them? Are they cracked? Are they breaking? These things lead to tripping hazards, which can certainly increase your risk. Insufficient lighting is a big one. If you are in your home and you have poorly lit areas in your home, maybe consider getting a floor lamp or increasing the lumens in the light bulbs that you're using in order to better light your space. And then pets. Certainly if you have a cat, it's probably hiding under the couch. But if you have a dog, it probably likes to run around your feet and hang out with you a little bit, right? So that can certainly be a risk factor as well. No offense to any cat lovers out there. So what we can do to minimize the environmental risks. Home field advantage. You know your home, you know your environment, you know where things are placed. Try to declutter that. Less is more, particularly when it comes to areas where we're walking. The fewer obstacles you have in the way, the less likely you are to trip on something, particularly if you're distracted, and even if it's not as well lit. We already talked about adding light bulbs with higher lumens, and there are also audible pet collars, which will allow you to hear the pet coming. If you're somebody who has to get up in the middle of the night often, if your pet sleeps on the floor, that may be a risk as well. Is there some way where maybe you can keep your pet in the room, but limit them from being in that path between you and the bathroom so they don't get excited and trip you in the middle of the night? Biological risk factors, these are a little bit harder to modify. If I ever find the answer to the age after I take care of myself, I will certainly reach out to the rest of you. So age is certainly a factor as far as biological risk. Gender, race, individual Caucasians are at a higher risk of falling than non-Caucasians. However, it has not really been fully established as to why that is. Certainly chronic illness can play a role because this can weaken your overall system and your physiology, and that is something that may or may not be modifiable depending on what intervention or treatment options are available. Certainly overall physical or cognitive decline. So how aware you are of your environment and your surroundings is certainly a factor, as well as your overall physical well-being. When we look at the physical decline that occurs with aging, vision is a large part of that. So 33% of 65-plus-year-olds will have some sort of macular degeneration. As far as strength, every decade after turning 30 is associated with a 10% loss of strength. And weakness is a significant risk factor for falls. So in a few minutes, when we get to the exercises, it's really important to appreciate that a good home program for balance should not just include activities that challenge your balance. They need to be activities that that challenge your muscle strength. Because if we don't do that, you're not going to have the strength to respond to the forces to prevent yourself from falling, which is why the strength is so important for your balance. As a whole, our main balance systems include our vision. So it's important to get regular eye checks and make sure that your vision is checked and you have any corrective lenses as needed or anything else that may be appropriate for you. Proprioception is our body's awareness of where our joints are in space at any given time. Jared's going to give you some exercises to help improve proprioception in a little bit here. Vestibular function, or your inner ear canals. These help your body determine where your body is in space relative to gravity at any given time. These are all compromised over time, and if one of them is compromised more than the other, we tend to compensate by overusing one of the others. Most commonly in the clinic, we see poor proprioception that people then overcompensate by using their vision for. When we look at the power of exercise in general, I'm just going to breeze through this, but highlights the importance that there is research showing that the faster people walk as older adults, the less likely they are to have a fall, and is also gait speed is a high predictor of overall health. And if we look at the tenets of exercise, there's research that tracked, are people getting the exercise they need? The recommended exercise is 150 minutes of physical activity per week. And we'll touch a little bit more on that in a moment. If we look at some of the other benefits, obviously we're reducing the risk of dementia, heart disease, depression. These can all lead to mortality. Reduces your risk of colon cancer, diabetes, stroke, high blood pressure. These are all factors that can reduce you or increase your risk of balance. So when we look at the exercise, not only are we just addressing some of the balance concerns, but we also can address some of these other contributing factors through exercise. So looking at people who already exercise. So this study is not looking at the population as a whole, but it's just looking at people who are actually exercising. And what it looked at is, are people getting the recommended 150 minutes of moderate intensity aerobic activity or 75 minutes of vigorous intensity aerobic activity, which is recommended by the World Health Organization. What this study showed is that of the people who are actually exercising, only 10% met the guideline with objective measures, which means that 90% of people who are active or believe that they are active in meeting their exercise goals are actually probably not getting what they need in order to reduce their risk, particularly when it comes to falls and some of these other diseases we talked about. So another recent study just highlights that point, that in a more recent one, 0 out of 84 subjects had met those World Health Organization activity guidelines. And so what constitutes moderate versus vigorous activity? Moderate activity includes things like walking at a brisk pace. And when we say walking at a brisk pace, that doesn't mean having a conversation with your friend while you're walking the whole time. You should be a little bit out of breath. You could still be able to talk and get some phrases or sentences out, but having a true conversation with walking, you're probably not walking fast enough to fall into that moderate activity category. Other moderate activity examples: cleaning, heavy duty cleaning, so washing windows, vacuuming, mopping, mowing the lawn, light bicycling if you're going for a leisurely ride, badminton, or tennis doubles. I know a lot of my patients when I worked in our Westchester office are big into pickleball. Pickleball would also be a moderate activity exercise. When we look at vigorous activity, this is where we're getting up to 70 to 85% of your maximum heart rate. And examples of exercises for vigorous activity would be hiking, jogging at 6 miles per hour or greater, shoveling, carrying heavy loads, or a fast cycle. And so I'm going to turn it over to Jared here, and we already talked about the importance of the strength training. So Jared's going to show us some strength exercises that we can do specifically for that. And then he's also going to look at some proprioception or balance exercises that we can do at home as well.
Yeah, thanks, Mike.
Yep.
Yeah, so Mike brings up a lot of good points when you're reading through the lecture there, right? And he's kind of explaining it. You know, if you're checking some of those boxes off in terms of like, all right, you know, I have this, I have that, or I have noticed my gait speed has been a little bit slower. I mean, these are simple exercises that can be done at home in a safe way. And we're going to go through some ways that you can make things a little bit safer for you, make it a little more comfortable so that you're willing to do these, improve your strength, because we already know that it is after each that decade, right? You have 10% of that loss. It will be harder to build up. But if you're able to stick with a regular program, you can see strength benefits, and then that's going to only improve your balance, whether it be you see what's coming, right? You're able to kind of prepare your body for it, or if it becomes more reactive and you don't know it's coming, like you step on your pet and you have to make that quick movement, but your body is able to stabilize yourself so that you don't have that fall or you don't hit into that object there. All right, so the first one we're going to start off with is just a basic squat. Okay, so let me kind of get everything to set up here. All right, here we go, and then we'll talk about what we're going to do, how we can do it at home in a safe way there. Okay, so again, the first one that we're going to do is just your basic squat pattern. So you're going to have your feet are going to be right shoulder width apart. You're going to push your hips back like you're trying to sit into a chair. All right, and then your chest is going to come down. So all of these movements here, right, these multi-joint movements that we're going to be talking about can have that balance component to it because you're taking your body from a stable position, and now as you start to bend and move, right, you're going to be throwing yourself off balance. So even though we're focusing on strength in this exercise, right, or excuse me, throughout these exercises, you have that balance component to it. So again, feet shoulder width apart. You're going to be pushing your hips back like you're going to sit into a chair, and then you're going to bend your knees here. One thing that may happen is if you are a person who has knee pain from before all of this happened, and that's kind of why you don't like to do squats, you can always modify the exercise by just not going down as far, by pushing your hips back, going a quarter of the way or a half the way, and then holding that position there and then coming up. Now, if you don't feel comfortable doing that, what you can do is pull in a kitchen chair or something that's going to be a little bit more stable. This is a little bit of a swivel chair, so I wouldn't recommend using this at home if you're doing this exercise for the first time. But the chair can be your guide now, so you know how far you're going down, and you know that if you do have that loss of balance because it's the first time you're doing it, right? As you go back, maybe you lose your balance, you have that chair there to catch you. But the idea is that you're going to go down, right? Push yourself back. You can tap the chair or you can sit all the way down and then pushing straight back up. We always recommend in the clinic, if we're starting off, like you can start with sets of 10 of this exercise, something nice and simple, and then you can gauge. If 10 was way too hard, then you go down maybe to 5 or 6. And if 10 was easy, then you can do a second set. So do another round of 10 right after that to challenge yourself a little bit. So again, feet nice and wide. You can sit down or you can tap. Tapping will be harder, and then coming up. All the exercises that I'm about to show you can be progressed even more by adding some resistance to it. So for an example, I have a kettlebell here with me, but you can use a gallon of water at home. You can use, your laundry basket if it's heavy enough, a purse, a bag, anything really, and you can hold it against your chest or in front of you. And then you can do that same exercise by sitting down and then standing right back up. Or if you don't need the chair, bending the squat, pushing, and then coming right up. So that's the first exercise that you can do. And again, if I went through that fast, this is going to be up on our social media pages later. So you can certainly go and review what I've kind of talked about here and the progressions. That way you always have a reference there in mind.
Hey, Jared.
Yes.
One thing, if anybody wants us to give them printouts or handouts of these, we can also do that. So if anybody would like pictures of these for home, they can email us at kineticptpa@gmail.com, or they can email us directly or certainly call the office. I know that I'd be happy to send them those, and I know you would as well.
Yeah, absolutely. Of course. I mean, if you ever have any questions, you know, that's what we're here. We're promoting these sort of things. Like, we're doing these webinars not only to educate, but to make sure that people are safe at home when they're strength training, because not a lot of people can get out right now due to COVID-19. But we want people to be safe and continue to exercise. So like Mike said, please reach out if you do have any questions that you realize after this webinar, or you know, even during the webinar here. So the next one that you can do at home is called a step up. So I would recommend using your stairs at home if you have some, or if you do have like one of those actual step up like exercise as well. But what you're going to be doing is just putting one foot up onto your step, and then just as it says, like you're walking upstairs, go up, tap, and then bring that same foot down off the step. So if I go up with my left, I push up, bring my right foot up, bring my right foot down, and then left foot down. This is a little bit of a progression from the squats, which works both your quads and your glutes. Here, it's a little bit more of a single leg, right? You're really emphasizing the one leg over the other. Now, you're asking, well, you know, how can this improve my balance there as well? As you're pushing, you're on one leg, so your hips and your quad muscle, right, they all have to kind of stabilize you as you push yourself up onto that step and then back down. So again, kind of working a two-part there. And then again, if you have a gallon of milk, anything heavy at home that you feel comfortable, you can push yourself up with the weight and down, and that will challenge you even more. I would keep the weight on the same side as the leg you're pushing with. That way it won't challenge your balance until you're ready. If you have the banisters at home, right, with the stairs, I would use that. Right, so for example, I'll just use the wall. This can be a way that you can just strictly work on the strength and kind of take a little bit of the balance component out of that exercise there. All right, so the next one we want to go over is heel raises. So this is going to work your calf muscles and the back of your legs. Again, very nice and simple, just going up onto your toes and then back down. You can have your feet nice and wide and do them, or if you want to challenge your balance a little bit more as you do it, put your feet closer together, and then we'll get to one of these balance exercises that looks very similar to this. So going up on your toes and then back down. Once again, going to sound like a broken record. You want to make it harder for yourself. Grab onto something, put it on your chest, put it in front of you, go up on your toes, and back down. So we've already worked on some exercises, right, for your quads, glutes, calves, a little bit of the hips here. Now we're going to go into something a little bit more challenging. So a lunge. To do a lunge, you're going to put 1 foot forward, 1 foot back. Now already this is a pretty difficult exercise due to its positioning. When we talk about a base of support, right, if my legs are really wide, my base of support is wide and I'm more stable now. As I get my feet closer together, I become less stable. Same thing happens when you're doing a lunge. So let me back up for a second here. If I put 1 foot almost in front of the other here, now my base of support is narrow and it's a little bit long. So this will be hard to balance with at first. So I would always recommend, if you have a wall there, put your hand on the wall to be able to do this. Then all you're going to do is drop your knee down, tap onto the floor, and then come back up. The goal eventually is to not tap your knee. It's to stay right above it and then push straight up. Again, a way to challenge one leg over the other as you get better with your strength exercises there. If you're having knee pain with this exercise, a lot of times this can put a lot of stress through the front of the knee, especially if you're leaning over top of your toes and then trying to go down. When really, we want to make sure that that knee goes straight down and your knee stays behind your toes in this exercise here. That's going to prevent your knee pain, or you can not go down as far. Those are some modifications you can make. That way, if you're having knee pain or you're having ankle pain, those are some small modifications you can make to decrease that pain level there. The last one we have is a deadlift. So similar to our squat technique, This one, any sort of resistance that you have is going to be on the ground already in front of you. So if you think of picking up your grandchild or picking up your child, picking up a laundry basket off the floor, this is the motion that you're going to be doing. So same positioning as our squat. Feet are going to be shoulder width. We're going to push those hips back, but we're going to keep the knees slightly bent and not go into that full bend. A slight bend, reaching down for your object, grabbing onto it, and then pulling straight up, and then back down. If you don't have any resistance, that's perfectly fine. This is a great way that you can actually just put your hands across your chest and work on your ability to hinge at your hips, and then come straight up. Like I mentioned at the very beginning, the moment you put your body into a different position, it's going to challenge your balance. So be careful when you first start to go down that you don't get too far over your toes and have that step. A chair is a great way if you want to hold on to the chair, and then you can do that hip hinge, right? So you have something stable here and then coming up. Or if you'd rather use the wall, same thing, you can go here against the wall or even turn and face the wall. But I recommend going from the side. I don't want you to hit your head there as well. All right, so those are some strength exercises that you can do at home. They're simple enough that they can be done pretty much anywhere, and you can use objects from around your house to either progress the exercises or regress them and make them a little bit easier for you. What we're going to go over now is some balance exercises to work on that proprioception that Mike was talking about earlier. So first one is going to be feet together, just standing here, all right? Because we narrowed that base of support, now our ankles have to work harder in this position to keep us upright, right? So now your body, your brain is understanding, okay, where is my body in relation to where my ankles need to hold me to keep me upright? If this is easy for you, the next progression would be to close your eyes. So this is where people start to really feel the challenge, because like Mike mentioned earlier, when the proprioception starts to go, we rely on our vision for our balance. The moment you take away your vision, now your proprioception, whatever percentage of it you have, let's just say it's 75%, now that has to kick in, and that is very difficult for your body to kind of adjust very quickly. So now you're using proprioception and your vestibular system to help you balance. That can be challenging. If that's too much for you, one way you can make it a little harder is by getting a yoga mat, a pillow. There are like balance foam boards that you can buy, and all you're going to do there is step on that uneven surface. So now, besides having something hard and flat underneath of you, we're going to have more of this uneven surface, and that's going to challenge you a little bit more. If you don't feel comfortable doing that kind of out in the open, have your wall ready, and you can balance yourself there. That way you can tap when you need to and take your hand away when you don't need to. Or you can have a person there with you, someone you trust, obviously, not someone that you think would just let you go, to kind of help you out in that situation.
Hey, Jared.
Yep.
One of the things that I've had a few people have success with the balance exercises at home is if you find a corner in the wall, and so I have a little bit of a corner here.
Yeah.
And so if I have a wall here and a wall here, and I'm in the corner, and then I can also put a chair with a backrest just to my right and just to my left. Now I have something on four sides.
Absolutely.
So if I'm a little unsteady and I go this way, I might bump into this wall. If I'm a little bit here, I might bump into this. And then if I'm with forward, I have my hands placed on something. So I've had some success with that, as well as a way for people to be able to challenge themselves, because we certainly want to, the important part with these balance exercises is if they're too easy, you're not going to get much benefit from them.
Right.
So we certainly want them to be a little bit challenging. Now, you should also be able to have a little bit of success with them, because if it's too challenging and you're just constantly holding onto the wall, your body's also not going to learn how to adapt to that either. So one of the ways that people I've had some success with is people doing it that way, and they feel a little bit more safe that way. So that's just another recommendation that I have.
No, absolutely. I mean, that's great there too. So when Mike was talking, just a few seconds ago about what is challenging and what's not, right? If you're standing for about 30 seconds, that's what we use in the clinic as kind of our challenge point. Like that's what we give for exercises. So if you're standing for longer than 30 seconds and you're not swaying at all and your body's not moving, right, that can be something, all right, maybe I start to progress myself, start to challenge myself. But if you also do an exercise, right, and you fall over within 1 second, like Mike said, you're not going to learn that. That's not, your body's not going to be able to adapt to that stress because it's not being placed on it for too long. So anywhere from 20 to 30 seconds, if your body is swaying and your ankles and your hips are working hard to keep you upright, that right there is that level of challenge that you want to be in. You can do a few sets of that, right? We usually do 3 or 4 sets of that 20 to 30 seconds, and then we vary the challenges based on how well you're doing. That can be your starting point, and then you can make it harder or make it easier from there based on how you feel. So next exercise, right? So feet together challenges more of your ankles, right? It lets your ankles kind of work as you're kind of swaying from side to side, right? We call that an ankle strategy. The next one here is called a tandem stance, where one foot is in front of the other. So this one kind of takes your ankles out of the mix just a little bit and puts more of the emphasis on your hips, so kind of your ability to balance this way. Just as we did before, on a hard surface, eyes are open, you challenge yourself for 30 seconds just standing here, right? So I'll kind of go sideways so you can see what it looks like. Just standing here just like this, and this could be enough of a challenge for you. If this is easy, you can try the eyes closed, but just be careful because you don't want to be able to get your feet tangled in this way. So what I would recommend early on is using that same foam pad with your eyes open and challenging yourself this way first. The foam pad is going to be enough to really start to throw you off balance. You can even kind of turn your head from side to side so you don't take your vision away completely, but you do have to change your target points, and that itself will make you sway from side to side. So before you go all the way to eyes closed, I would try the head movements, looking at different things around your room. When you're doing this exercise, you need to switch legs because one leg will be emphasized over the other. The one that's in the back is the one that you're working a little bit more of. All right, and then the last one that you can do is just balancing on one leg. This is so you start with feet together, you go to tandem, that gets easy. Now you're going to go to your single leg stance. So now you're taking your whole body weight, you're putting it on one leg, making sure that the hip that's down is the one that's working, the ankle that's down is the one that's working, and you're balancing here. Just like we said before, take your foam, put that down, step on your foam. This is your next progression up, and then you can go with your eyes closed. And then that could be just enough of a challenge there for you. Mike, I don't know if we want to mention the one thing about like how we talk about strategies, like ankle strategy, hip strategy, and stepping strategy. We need to practice all of them because our body reacts to different stimulus. So if you get bumped into, right, your body will first try to use ankles to correct you. If it can't, it's then going to try to use your hips to kind of throw the opposite way. If it can't do that, then it'll go into a stepping strategy there. So the reason why we talk about this is this just became pretty much a single leg stability exercise, simulating our step-ups, simulating our lunges. That's why it's important to go through all of these exercises and challenge yourself not only balance-wise, but strength-wise as well. So if you are walking and you do have that, maybe you trip or catch your foot on something, right? You catch your foot and you make that step. Now you're in that lunge pattern, but something you've already done. So just, it's always good to review, try these exercises. Again, Mike and I are here in case you have any questions about anything or you need to review any of the exercises. But those are some good ones to start off with, and then you can build and progress from there.
Great. So some takeaway points. Thank you for that, Jared. Awesome stuff.
Yeah.
So just some takeaway points. Setting yourself up for success by managing your risk. Only, if you're having trouble assessing that risk by yourself and ways that you can find in your day-to-day life to reduce your risk, reach out. You can certainly reach out to Jared and I. We're happy to help you if you have a physician that you have a good relationship with, or even if you have another physical therapist that you have a great relationship with and you're just not sure where to start. Reach out to them, reach out to us. We can help you identify what risks that you may be able to modify to reduce your risk of falling. Everybody should be exercising in a safe and sustainable way. And when we are exercising in those ways, keeping in mind that we want to reach those certain thresholds and goals, which a lot of us aren't reaching when we're exercising. And if you're currently inactive or at high risk for fall, certainly consult a physical therapist to initiate a program tailored to your specific needs. It is never too late to start. We talked about this in our lecture last week, which is on our YouTube page, myths that you shouldn't believe about exercise. And there's a common misconception that at a certain age, you've lost the ability to get stronger or make change. And that's just not true. The fact is, these same exercise principles apply, and it's never too late. We just need to find a safe way and appropriate way for you to initiate it. So if you're concerned or think that PT may be appropriate for you, if you have a history of falls, if you believe that you have a high risk for falls, if you maybe are in that medication category, if you have some other vision problems, if you feel like you have proprioception problems, then you might be appropriate for physical therapy. If you have a fear of falling, we can work with you to help reduce that risk of fear by showing you safe ways to move to improve your proprioception, your strength, if you're not comfortable doing these things at home that we showed you today. Joint or muscle pain, if that's preventing you from moving or doing the exercises or the balance activities that Jared showed you, then it would be appropriate to consult with us. If you feel like if you have some other underlying comorbidities that you're concerned about, then it's certainly worth consulting with a medical professional to initiate an exercise program. Again, physical therapists are great to do it. If you have one that you already love working with, by all means, reach out to them. But Jared and I are also available as well. And for more information, some quality resources, again, there's a lot. It's tough to find quality resources out there, but the National Council on Aging is a great resource for information, as well as the World Health Organization. The data and the information on there is really good, and typically the most research-based and evidence-based information, as well as the Center for Disease Control. Another great resource for quality, typically unbiased and research-based evidence. If you guys have any questions, we will look out for those now. We'll hang tight for a little bit. By all means, if you don't have any questions today, feel free to reach out to Jared or I. Our emails are listed on the screen here. We're going to leave that up for a few minutes so you guys can write that down if you'd like. You can also check out our Facebook page for future presentations and discussions. We're going to be doing weekly discussions of some sort, so if you're interested in the topic, you can jump on for that. You can also view previous webinars, previous topics of discussion at our YouTube page. If you go to youtube.com and search Kinetic TV, you'll see the little Kinetic symbol pop up, and all of our recorded webinars are on there. This one should be up by next week.